Which of the following tubes is commonly used for hematology testing? And now we have all these different tubes here, and they all have different colored tops that are being described here. So now we'll draw all the different colored tops. And this is something you may have noticed, maybe when you've gotten blood drawn before. But if you're new to the topic of blood draws, you may not have noticed that these colors had a special meaning in the past. You might have just thought, oh, this is the color of the tube. But in actuality, the color of the top has a different meaning, and certain tests are done in certain types of tubes. And the reason that this is important is because some tests need certain types of preservatives to be within the vial to keep the blood from clotting or coagulating, or there might be time tests where we need to use certain tubes for those time tests, and the caps help us to identify these types of tubes, so they're used for a reason. And usually in your lab you'll have a list of, oh, if you're drawing up this type of test, you should use this type of tube, and it'll usually say on the orders which color top to use for the test. So now we need to know which test is used for hematology testing. And your hematology testing is referring to a specific type of test. So that has to do with your CBC or your complete blood count. It has to do with your hemoglobin A1C test, which is a certain test that we use usually in diabetics to see how well they're managing their glucose over the period of a month. And it also has to do with anticoagulant testing, which has to do with blood clotting. For this reason, we want to make sure that we're using a tube that has something in it that would prevent the clotting, because in order to accurately test for all these things and the different components of the blood, we need to make sure that we have each component exactly as we need it, and therefore we need to pick a tube that has these preservatives in it to prevent the clotting. So fortunately for the real world, when you're working as a medical assistant, you probably won't have to commit this to memory, and you shouldn't, because it'll say in the orders which type of color top you should use, and it won't be in your lab. However, for the purposes of this exam, we do need to commit to memory which type of tube is used for which types of samples, and this is something that you might find that you do end up naturally memorizing just from doing it so often. So let's go over what each top is used for. So option A is the blue top, and the blue top has citrates in it, which is used to measure clotting times. So it's used for testing PT-INR, which you might have seen before, but this is not considered a hematology testing, like over here when we were talking about our CBC, A1C, things like that. That's different than what we're describing in the blue top example, so we can eliminate that. Now let's look at option B. This has to do with like your lipid testing, your lipid panels, your fat testing, and there's no preservatives that are needed for this type of test, and therefore this is not what we're looking for. This is not the hematology testing, so we can eliminate that. Option C, the lavender test, is your correct answer. This is the one that has the special preservative in it that is used for testing your hematology testing, like your complete blood count, your hemoglobin A1C, and your anticoagulant testing, and therefore that would be your correct answer here. Now let's take a look at the last option, the gray tube. Your gray tube is used for glucose testing, glucose and glucose tolerance testing, and therefore it has special preservatives in it specific for glucose to prevent the breakdown of glucose. So therefore we will eliminate option D because the question is asking about hematology testing, and in this case that would be the lavender tube.